MRI investigation has become very, very, very common. MRIs easily available, wonderful testing. You will know all soft tissues, how they are there any tumors, smaller fractures, everything is good. But earlier days, we used to check MRIs of people after completely examining clinically. पहला अच्छी तरह से पूरा फिजिकल एग्जामिनेशन करके and you also plan your treatment protocol and then you check MRI to confirm. It's only a confirmatory investigation normally. In extreme cases of cancer and other things, they're different. Serious things are different. Every person comes to me with a minor shoulder pain. He comes with an MRI of shoulder. What I did, even for a normal people without pain, I took couple of MRIs of shoulders. All of them have shown supraspinatus tendon injury, some tear in the joint. What does it tell? This will happen. If you take an MRI of your shoulder, you will go to operation theatre. All shoulder, even a severe injuries of shoulder, barring traffic accidents, fractures, you keep them aside. Non-accidental, day-to-day life, people, everybody has a frozen shoulder. When shoulder joint is tight, you try to do something, you'll get injured. First, you go and read your own MRI report of shoulder, always written supraspinatus tendinosis or tendinitis or tendon injury with some other tears in surrounding areas. Why it is happening? Because you are trying to use your shoulder more than its range. The range is reduced because of diabetes, because of thyroid disease, because of vitamin deficiency, because of wrong nutrition, and because of sports injury. All these will make your shoulder tighter. I wish that bowler Malinga should have come to me. I would have treated him. Everybody was cursing for his bowling action, but nobody checked why his action was wrong, because his shoulder was frozen. Now, it is very clear why your shoulders become tight. Simple thing, tindi yanda in Telugu. If you are not exposing to sun, or you are living in a city where you have no access to sunlight, and when your diet is faulty, you will become severely vitamin D deficiency. You will see that you are deficient in vitamin D, along with other fat-soluble vitamins also, A, D, E, K. All of them will be deficient. We are only checking vitamin D. Then next, along with them, your calcium mechanism, along with them vitamin B12 and little bit of lowering of iron also happen. These are my observations. My dear friends, you must not worry if your shoulder is tight. Use only limited movements. Suppose your hand is free, little bit in front, you do it. I made a lot of videos on frozen shoulder syndrome. But don't forcibly, don't do any yogasana. Don't do any physiotherapy for your shoulder. Don't take an MRI unless there is a traffic accident injury, bone is suspected to be broken. Otherwise, don't take an MRI, because your mind will go out of range. 99% of MRIs of a shoulder joint will show supraspinatus muscle tendon is affected. Why? Because that is only muscle involved in 0 to 15 to 20 degrees of movement of your shoulder. And once your movements are reduced, your deltoid muscle, that is outer side of your arm, that becomes weak. So it's a vicious cycle. Your shoulder will become weaker and weaker and weaker, and all these will going to affect your neck and back. You have seen my videos earlier. So my advice is, if your shoulders are tight, check, do you have diabetes, hypothyroidism, or disorders of intestine, or micronutrient deficiency, especially vitamin D deficiency. Take rest, put some warm packs, do gentle movements in front, and once you clear all these medical conditions, then only you indulge in exercise in a proper advised manner. Don't do anything, because pain coming from a shoulder joint is not from shoulder joint, it is coming from the neck. So this is the take home information. So please check your shoulders, and you may be aware only these diseases, they come later in life. Only above 40, above 30 will have frozen shoulders. No. I am seeing today 5 years onwards, because younger age group vitamin D deficiency is very, very common. Almost 30 years I have been working on vitamin D. I am telling you, you see so many videos and so much of authentic, non-authentic information, but you must keep in your mind, younger children from 4 years, 5 years onwards, they are all deficient in vitamin D today, because their school uniforms have changed, they don't go outdoors, there are no physical training PT classes in schools, and parents are busy, buildings are closed. How they are going to get sunlight? And your food is changed, because every Tom, Dick and Harry, one naturopath, one agriculture scientist, one accountant, and anybody can advise you diet and nutrition. No need of expert. So you are in danger. So take care of yourself. If you need any help, please do not hesitate to contact.